Most people associate radioactive materials with weapons and power stations. But whilst radiation can be harmful, in a branch of science known as nuclear medicine, it is used to help patients in diagnosis and treatment. And now, with the very latest research, nuclear medicine is even offering hope against some of our most dangerous diseases. From emergencies to routine checks, the busy wards of Britain's hospitals are open 24 hours a day, 365 days a year. Every year, some 12 million people pass through them. On the surface, it doesn't seem like a likely setting to find a nuclear scientist, but Dr. Val Lewington is a unique type of doctor.
I'm a consultant in nuclear medicine here at the Royal Marsden. I came into nuclear medicine from being a general physician and then specialised. And the beauty of nuclear medicine is that it's one of the few specialties that allows you to mix with a whole team of people from different disciplines. So there are the medics, but there are also nurses, radiographers, technicians, scientists, and you get to be at the very cutting edge of development in a very interesting area of medicine.
The research of teams like these is changing lives, especially for patients like Suzanne Richmond.
Originally I had some lumps, one starting under my arm and in the groin, and went to the hospital. Then they decided to do a biopsy to see what was causing it, and that's when I was diagnosed with lymphoma.
Lymphoma, like all cancers, is caused when cells start to multiply and grow uncontrollably, forming tumours. In the case of lymphoma, the tumours grow in the lymph system, a complex network of tubes, rather like the bloodstream, that helps to transport substances from place to place around the body. The usual treatment for this disease is a course of chemotherapy, which involves taking drugs that work by poisoning cancer cells so that they don't divide and produce new cells.
Because the chemotherapy attacks all your cells in your body, good and bad, it makes you feel pretty grotty. Added to that, you have things like steroids attached to it, and it does make you feel really rough.
But not all cases of lymphoma respond well to chemotherapy, and it wasn't long before Suzanne was having to return to hospital to discuss what her options might be.
Hello, Suzanne. Obviously, it's disappointing that the disease is still present on the scan. I mean, just to recap your treatment, you have had the conventional chemotherapy, which was a long time ago. Unfortunately, as we expected, there is still evidence of lymphoma there, and we have to decide what to do. And I think we should explore other options, including perhaps radiotherapy, which we haven't used yet, and lymphoma cells can still be sensitive too.
We all know that radiation can be harmful, but used in the right way, it can also be beneficial, and its cancer-killing properties have been known for some time.
We've been using radiation in medicine for many years now, and so we know a lot about the potential risks and benefits of radiation exposure. We know, for example, that very high doses of radiation will damage DNA so badly that we stop cells from dividing. And obviously, in terms of cancer treatment, that's exactly what we're trying to achieve. But on the other hand, lower doses of radiation can sometimes cause DNA damage, but not prevent the cell from dividing. That means that potentially minor DNA abnormalities could be replicated in later generations of cells, and in the long term, that might lead to the risk of inducing new cancers.
This difference is key in treating patients like Suzanne. Depending on the type and dose of radiation used, it can be useful, destroying DNA to kill unwanted cancer cells, or harmful by causing mutations that can trigger cancer. To treat Suzanne successfully, scientists would have to identify the most useful type of radiation to use and then work out how to deliver it. When scientists first began to look at how to use radiation in medicine in a safe way, they were helped by the fact that there are 3 types of radiation, all with differing properties. Alpha radiation is absorbed by paper, as it is not very penetrating. Beta radiation gets through paper or a thin layer of cells, but is absorbed by aluminium or plastic. Because it is very penetrating, gamma radiation is only absorbed by several centimetres of lead and can pass right through the body. Understanding these properties has helped scientists develop different ways to use radiation in the treatment of cancer and other diseases. Scientists working on treating lymphoma had a very exact problem to solve. They had to find a way of delivering a dose of radiation inside the body that would kill the cancer cells whilst leaving patients like Suzanne unharmed.
Right, William, what I'm going to do now, I'm going to connect these transfers.
Gamma radiation, the most penetrating type, was already being used safely by specialists in the treatment of skin cancer,
The radioactive source is going
who deliver the minimum effective dose to just the area that needs to be treated.
Mr. Mackenzie, just going to fit this shell.
The first step in ensuring this is to create a plastic shell that fits over the area to be treated. The doctor has already marked this area on the patient's hand, and this is then traced onto the shell.
Okay, Mr. Mackenzie, I'm just going to trace through where you're going to be treated.
Plastic guides are then attached to the shell directly over the area that needs to be treated. Tubes can then be passed through the guides to prepare the shell for treatment.
We will then calculate how many times we want the radioactive source to sit on the shell in order to give a nice even dose of radiation to the area that is being treated. We need enough radiation to be able to kill off the cancer cells, but not to kill off the normal cells, because we want the normal cells to reproduce so that the area will heal.
This machine contains a wire of radioactive iridium that constantly gives off gamma radiation. So the dose of radiation is determined by the amount of time the iridium tip is placed over the hand. The shell ensures that the radiation dose is only directed at the cancer cells, and the rest of the body receives a dose that's known to be within safe limits.
Right, William, if you could just move your hands.
This type of treatment, which delivers radiation outside the body, is known as brachytherapy. And the simple mould method is a very successful way of ensuring that the radiation is only administered to exactly where it is needed.
Hi Elaine, how are we getting on there?
But how could this treatment be adapted to treat a cancer like Suzanne's lymphoma?